Rangani Gagalagamo is one of many Sri Lankans whose homes are flooded. But she doesn't have time to think about the devastation because she is a community midwife.
I
have to stay strong because they need that strength.
Rangani is among dozens of health workers treating flood victims. They are operating mobile clinics, chlorinating wells and distributing medicine to prevent waterborne and other diseases.
I'm scared they'll get sick with all the floodwater around.
The medical officer health in Bulathsinhala is coordinating efforts in one of the worst affected areas. He says the healthcare system wasn't prepared for a disaster of this scale.
Rat fever, that's very endemic to this area because they are dealing with floods. The other thing is skin infection. That is most probably because they are dealing with floods. Obviously, they can get many sort of skin infections. The other thing is secondary bacterial infection because the water is contaminated with bacteria and the injured people, wounds can easily get contaminated. The other problem is, again, the diarrhea.
His office is receiving adequate supplies, but many patients are marooned with little or no food or water, let alone medicines. With serious patients being moved to bigger hospitals and medical teams fanning out on the ground where possible to treat those for flood-related and waterborne diseases, beds here in Bulathsinhala Hospital are relatively empty. The medical authorities are hoping that it stays this way. Minelle Fernandez, Jazeera, Bulathsinhala, Southern Sri Lanka.